want to provide you with the resources for the languages. So if you want to study, you know, the biochemistry of adipose-derived stem cells and how those can be used in myriad clinical applications, very exciting when you see some of the, you know, clinical applications. It's exciting to be able to explore that, but you need to be able to speak the language and understand the concept. So my job is to try to make it simple, but to make it comprehensive. And so if you hang on and bear with me, I'll try to stay focused and deliver this content to you in a way that you can actually use. You can read a paper, you can look up a project, you can get involved in a research project. And you know, we have an incredible world today that we're all connected. And how this organization found me was through Facebook. I use Facebook almost exclusively as one of my information sources, and I connect with people and patients all over the world. And it's never been more exciting that Boston BioLife has become a worldwide organization. But our goal is to help. It's to help educate, it's help to translate, and it's help to communicate the concepts of science. So anyone can, whether you're a patient or a researcher or a doctor or a nurse or a businessman, you want to see the opportunities in keeping ourselves healthy over time. Our most precious resource is our health, and our most important component of that is the quality of our health. So what are cellular products? Okay, so we have autologous, like I said, that's from us. So your bone marrow aspirate, if you look on your little sheet that I sent you, bone marrow aspirate and bone marrow concentrate, this is harvesting the cells from the bone marrow, primarily from the iliac crest, but there are other areas you can get it. You can get it from your long bones. Autologous fat, this is taking the fat around your love handles and we aspirate it with tumescent fluid and we separate it. Platelets come from your blood. You can grow and culture cells, not necessarily legally. Cells come from different sources like birth products, after birth. These aren't embryonic cells. So just to make that clear, you'll hear people confusing it, you know, embryonic research with stem cell therapies. They really have nothing to do with each other. Embryonic tissue is useful and it is used for research, and there are people, but none of that's commercially, and no commercial activity drives that preface. It's not as if that has any demand. It's just something that can be done. Cord blood cells are interesting because they're the blood supply between the mother and the fetus, and they have a whole host of extremely important proteins. And then you look at what a cell can excrete. So we'll talk about cytokines and growth factors, anti-inflammatories, things that prevent enzymes from degrading you, things that keep microbes from killing you, and things that keep cells from dying in general. That's anti-apoptotic. And I think you may see apoptosis on your list. So what are stem cells? Stem cells possess a process called asymmetric division. So you remember from fundamental embryology that one cell, two gametes come together to form a zygote. So we got the egg from the female and the sperm from the male, and they create one entity. And then that divides and divides and divides. And so you get all the different undulations of evolution. And they're key to the asymmetric division in the beginning before they're committed to a particular lineage. And you'll see how that happens. You have this process. So stem cells are unique in that they have the different levels of potency, and we'll talk about that. But you got hemopoietic stem cells, which come from the bone marrow and the blood. But bone marrow stem cells, these have the ability to become blood, adipose stem cells, and then you have your perinatal sources. So the three from people, bone, blood, and fat, and the products that come from birth products. Again, these are from donated placentas of C-section births. Almost 1 in 3 births is a planned surgical section. And so you can really see how there's an abundant supply, and they go through really stringent processing and certifications. And there's the American Academy of Tissue Banking. It has a lot of regulations. So it's a regulated field, although it's kind of open in research areas and it's poorly understood. So perinatal biologics, in my opinion, offer one of the greatest opportunities in medicine. However, socially, they're not well accepted, and politically, they're difficult to get into clinical areas because they threaten so many other parts of medicine, surgery, and drugs. But there's not a pharmaceutical company on the face of the earth that doesn't have their eye on them as a source of research and development for potential therapies. Just know that. So within cell therapies, we have opportunities. They're very dynamic. They migrate, they proliferate, they respond to their environment. So working on a cellular level is a very powerful tool clinically, but there's a lot of challenges because it's difficult to, you can't sterilize them. They die. They have limited shelf life. So there's a lot of technology that's inherent in how to manage cell therapies and how to apply them. Just a quick history on this. A lot of people think that regenerative medicine or stem cell therapy is brand new. As a matter of fact, it goes back thousands of years. The word repair comes from the Latin word repair, which means to repair, to regrow, or means to liver. So repair and repair goes all the way back 5,000 years. And as recently as this century and prior, we have bone marrow infusion. People started to understand the value of bone marrow for people with blood disorders. And these guys won a Nobel Prize. More recently, about 35 years ago, Philippe Hernegot from Paris, St. Mary's Hospital, was conducting bone marrow studies, and he knew that bone marrow could rejuvenate avascular necrotic tissue, things that bone, necrotic femoral heads, and a lot of things that led to orthopedic applications. And he literally harvested and sampled and counted and categorized thousands of patients, and he has a very robust database of the stem cell populations that are from bone marrow and how they can be used clinically. And we've known that Dr. Hernegot has been a leader in this field for a long time and still is. He continues to do research. Arnold Kaplan, you may hear from him. If not, you should look at his research from the Cleveland Clinic and other areas. He basically is a professor. Make sure I don't.
Your mic is open. Yes, your mic is open, and I will knock you, or I will.
Yeah, I'll just look for your. Okay. Okay.
So, thank you.
All right, so we're back. I think we're back. Anyway, we're going to talk about what is a stem cell, and gave you a little history, gave you some background and some ideas on the different players. So stem cells are single cells that obviously can replicate, but they can also differentiate into different cell types. They become committed along a line, and whether they become bone or blood or fat or hair or skin, it all depends. And there's different opportunities for cells to differentiate along pathways of embryonic development. So as a zygote, every cell has the potential to be everything. As you become more divined embryonically, you have the ability to stay within certain areas like endo, meso, ecto, and as you become, so you're pluripotent, you become different tissue types, and as adults. And then induced pluripotent stem cells are interesting because you can create cells out of you can create regenerative medicine stem cells from your own body tissue. So you can take a skin cell and use that to create a cell line that can be used to create, say, a pancreas or a liver. So different types of stem cells. Adult stem cells are the ones from you. Embryonic are from embryos, and those are the ones that are researched. They're very controversial, not commonly used. Perinatal stem cells are the ones that are created prenatal, but postnatal, which they call perinatal, are derived from newborn birth products, so like placenta tissue. The mesenchymal stem cells are periocytes. Periocytes live on blood vessels, and they kind of work to address injuries in the area. Every tissue has blood vessels, and the blood vessels have periocytes. Periocytes are responsible, they're like the first responders, if you will, to going to the tissue and initiating repair. Mesenchymal stem cells, they're cells that help repair muscle, bone, and cartilage. There are adult stem cells. In terms you'll hear such as autologous, meaning they're from the same patient or the same person, are the best because they don't have rejection, but they're also limited because they're from you, and you want stuff that's perhaps better than your own tissue. So MSCs, again, have the ability to reduce inflammation, fight cell death, and they become many different tissue types. We're going to go over some of the sources of these cells, and one is very popular, is bone marrow. And so bone marrow comes from the spongy part of the bone, and it has fat cells with member cells, signals, and scaffolds. And cells are able to find their way around the body by a very complicated term of homing, looking around and seeing where they need to be, where they're needed. So autocrine is a tissue that secretes cells to help itself. Juxtacrine are cells that communicate with each other right next to each other by touching or forming a relationship by contact. Stimulus. Paracrine is really acting on cells that are close by, and endocrine is like your endocrinology system where you're able to affect parts of your body from different organs like your thalamus, your reproductive organs. Cytokines and growth factors are important. Cell signals that are, here's kind of an example of a ribbon protein with some polysaccharides, kind of an exciting looking structure. And cytokines are a broad class of molecules that are important in cell signaling. And they act through receptors like an acceptor ligand, and they function within the immune system, and they modulate various cell behavior. Some cytokines enhance activities, some inhibit, but they're very important communication molecules. They're different from hormones, which are also important cell signals. Hormones circulate in less variable concentrations, and they act on different types of cells. So that's kind of like testosterone or estrogen. And cytokines can be all different types of cell signals, and they basically result from different tissue types like interleukins or interferons, and they have the ability of working in many different capacities in different cell types. Interleukins act as mediators between leukocytes, lymphokines, monokines, and interferon. They're all different examples of cytokines, which again are cell signals. And then we have growth factors. And growth factors are small molecules that function between cells. Some are cytokines and some are hormones, but they bind via receptor ligand interaction, and they promote cell differentiation and maturation. Growth factors are important. The chemical messengers, the regulation of cellular and nuclear function of cytokines and growth factors and peptides or proteins. Hormones are initiated through activation of cell surface receptors, so that's your receptor ligand binding. Specificity, here's different types of growth factors, and they all come from different tissue types and promote things within those tissue types. Most of them have similar in that they create angiogenesis, and they work on rejuvenating endothelial levels, layers, etc. So we're now going to get into the various biologics, and the most important and useful and interesting ones that come from ourselves, autologously derived. And here's platelets. And platelets are small fragments of cells in the blood that respond to injury by aiding in the clotting process. So platelets you may have heard of. Here's what a platelet looks like. It's not a cell. It acts like a cell. It has different components, but it doesn't have a nucleus. And its job is to kind of initiate different chemistry in the body, responsible for repair or restoration or replacement of cells by using the blood. So platelets form in the bone marrow, as the bone is responsible for hemopoiesis, and they travel along the blood vessels. So one of the applications for platelets is platelet-rich plasma, PRP. And the term platelet-rich plasma is really the concentrations of the platelets in whole blood by using centrifugation. Here's what a platelet looks like prior to activation. It's kind of folded up on itself, and then it turns into that starfish motif after activation, starts releasing proteins like thrombin and other growth factors that can initiate clotting and also stimulate healing and repair in distal tissues. So within PRP, we've got white blood cell constituents and proteins, and endothelial cells, and there are different structures within platelets that help facilitate healing. And so platelets and PRP are very commonly used in orthopedics and also aesthetics, and they've got some applications in hair and sexual wellness, but they're very easily to get. You basically pull peripheral blood, and you can spin it down, concentrate the platelets, collect them, and then inject them. Here's a schematic of PRP, what it looks like. And what we're looking for is that buffy coat, and the buffy coat is where the platelets are. It's a very small percentage of the total blood. But keep in mind the plasma has a lot of different proteins in it. It has a lot of benefit that isn't currently known because we haven't explored the different proteins, but things like IRAP and A2M, some of the interleukins, come from that. So common conditions where PRP is used in orthopedic, so these are orthopedic applications: meniscus tear and muscle tears, degenerative arthritis, disorders of the spine, shoulders, etc. So we see, and then there's the proteins. So here's two of the proteins that are found in plasma: alpha-2 macroglobulin and IRAP. They're important because they help keep cartilage from degrading, and they're antimicrobial and anti-inflammatory. So interleukin-1 is the first messenger for an injury. The acute phase response is mediated by the first responders of the interleukins. By inhibiting interleukin production, or the actions of interleukin after stimulated, we find IRAP, which is interleukin-1 receptor antagonist protein, which means it stops the activity or the behavior or the influence of interleukin-1. Moving on down the line to our next autologous from you derived source of regenerative medicine, we have adipose, fat tissue derived stem cells. So as it says here, adipose tissue is a treasure trove of stem cells. There's a lot of fat in our culture and our society, and there's now novel ways of isolating and fixing and purifying the different constituents of fat. And we find that cells, there's lots of different cells in fat. There's extracellular matrices, and they have a lot of different features that can be used for reconstruction and regrowth and stimulation of growth. And they also have extracellular matrices, which help them graft and stay in place, and they also become a great substrate to put other things in. So not only are they acting as a source of stem cells, they also contain soft tissue, and they can be used as a scaffold. So you often see fat used in breast reconstruction, facial reconstruction, and other areas. Basically, this was discovered by plastic surgeons, cosmetic surgeons that had, a lot of experience with removing fat from patients for different cosmetic reasons. Some of them were clinically necessary, but also finding a new way to use these to restore facial features in other areas that perhaps, were lost into injury, etc. So how do you isolate adipose-derived constituents? So the first method is through enzymatic, using collagenase or other proteinases, and the other is mechanically, by physically breaking things apart. So the enzymes are more specific and they're a little bit more targeted, but they're also more controversial because they're not certain that you're completely keeping integrity of the extracellular matrix. And there's other methods and tools that have been used, such as centrifuges and other mechanical techniques. Here's some of the commercial applications: utilization of devices and machinery that help process fat. And again, what I mentioned in the beginning, I noticed that we discussed the role of other clinical applications or career opportunities in medical science or biotechnology science, and working for companies like this as a product specialist or an engineer or a researcher is very exciting opportunity outside of academia. Here's an example of harvesting fat, bringing it in to a centrifuge, which then you can use to filter and remove and wash. And here's kind of like some of the areas, the different components within fat. It's just a cartoon, but it shows you adipocytes, and you've got the ones that are becoming adipocytes, and then periocytes and preadipocytes and macrophages. So there's a lot going on within adipose. There's immunomodulatory behavior, there's thermogenic behavior, there's fat storage, there's energy release, there's other signals. And fat is more than just cushioning and support, and it's poorly understood, but it's really one of the bastions of opportunity in regenerative medicine, in my opinion, because there's so much of it, and it has so much value, and none the least of which is its ability to grow blood vessels, which we know are important. So getting to other players in the game, bone marrow stem cells are called BMA, bone marrow aspirate, or BMC, bone marrow concentrate. One is just removed and the other is spun down. And so bone marrow cells are from the bone marrow. They're responsible for hemopoiesis and creating all the blood cells in the body. Here's a schematic of how they come, where they come from. So you have the medullary bone, the outside bone, and the cortical bone, the inside bone. or the other way around. Cortical's outside and medullary's inside. And you have the spongy area that contains fat, extracellular matrices, cells and signals. Remember, cells, signals, and scaffolds. So bone marrow is rich with all these things. And Hernigu, the gentleman we mentioned before, his research was really on, can bone marrow transplant regrow bone? And the answer is unequivocally yes. We've now utilized that to regrow bone, but we're also exploring its ability to rejuvenate tendons and ligaments and joints as well. So bone marrow has a very strong promise in regenerative medicine, especially in what they call orthobiologics. And so it's very important to understand how this works. And so you have a device called the Jamshidi needle. They go in through the iliac crest to a wide area, and they might make more than one track. And the idea is through rapid suction to remove the different, the skin. I'm sorry, to go through the skin into the medullary bone, and then to create suction to pull the periocytes from the blood vessels to concentrate those and to then use those interarticularly or into ligaments and tendons to help rejuvenate. In recent times, the last 5 years, I would say, and certainly longer than that, but most recently, exosomes have drawn a lot of attention and have shown tremendous promise as their ability to create custom microvesicles to deliver very unique specific packages to targeted cells and to be leveraged as a tool for regenerative medicine. Our COVID vaccine is in fact an exosome with a piece of microRNA in it, having the message for the spike protein, which is used to help the immune system recognize COVID, the coronavirus, SARS-CoV-2 as a foreign body. And we'll find as the evolution of our vaccines and targeted immunotherapy grows that the putting messages in bottles, if you will, or putting in this case microvesicles so that they can communicate messages across a long distance is very important. And mRNA allows neighboring cells to produce the required proteins without having the genetic message. Here's an electron microscopic image of stem exosomes and different cellular matters, and you see the small microvesicles less than 100 nanometers in size, and they come from multiple sources. Every cell makes an exosome. You can stimulate them, you can culture and expand cells to create them. They can be purified, characterized, isolated, and produced. They can be used in clinical opportunities, and they have been. They're not without their scrutiny, they're not without their controversy, they're not without their potential as well. However, there's a lot more research that has to be done, but we're really looking at the ability to create custom molecules or influencing our own genomics using the method of exosomal cell signal transfer. So looking closer at ECM, we now look at the cells, signals, and scaffolds. So what is extracellular matrices? It fills the voids between cells. It's the structural the component that keeps cells organized in tissue form, but it also works as a blueprint for the architecture of the tissue to communicate and to passage and message along its pathways. There's a lot more that meets the eye with extracellular matrices, and I think you'll find this to be an area of ongoing and consistent research as looking at ways that we can activate ECM to be a very influential partner in cell and tissue regeneration, as well as tissue engineering. It's very important. So fibrin, people are using fibrin. It's a glue. They use it to provide structure in deficits. You can use it to heal. There's platelet-rich fibrin matrix, which is pulling your own clotting material out of our blood, as you see on the right, upper right. And then you see the chemistry of it. It's just a lattice, it's a network, it's a web. It's made of proteins and sugars, and it's highly malleable, and it configures and communicates with the cells and tissues that it's involved with. The last classification of cells that we're going to talk about are what I call perinatal biologics. These are based on products that are derived from amniotic membrane, perinatal tissues that come from umbilical cord and cord blood, amniotic fluid, placentas, etc. 1 in 3 surgeries pregnancies or births in the United States are a planned surgical section. It's a tremendous opportunity to harvest these tools and to use them in clinical practice. Cord blood, which is got a high safety profile, been used for years. It's not without its critics, and there are some HLA issues, but it's really important in stimulating the immune system to heal and boot up, jumpstart the immune system, but also I think it helps with some of the serum proteins to help facilitate healing through bringing in things that are more rejuvenatory, if you will, from the prenatal source. So some of the proteins in the serum I think are helpful in helping the donor heal. So umbilical cord cells are the most easy to differentiate, and they're found within the body, and you can find these. So there's a great number of research projects being done with these cells in things such as Wharton's jelly, which is the lining of the umbilical cord. They're rich in extracellular matrices, they're rich in stem cells, so they got the cells, the signals, and the scaffolds. They're very similar, in my opinion, to bone marrow, or even fat, where they have the matrix, they have the cells, but they have the signal component. Really helps when they get transplanted to assess their environment and to affect a response. So what is the purpose of the placenta? So here's a quick overview of perinatal biologics. And the placenta is used to protect the fetus, obviously to cushion it, but also to provide the necessary nutrients. And it stands to reason that it would be a very important resource to have the ability to provide all the things necessary for a newborn baby or a fetus to become a living human being. So we've got stem cells and growth factors and cytokines and extracellular matrices, and it's its own little world. And you can look at the different membranes, but really they're complicated. So what's the placenta membrane? It's really an outside, a middle, and an outer, intermiddle, endo, meso, ecto, if you will, structure. And each one of these has a clinical constituency that's novel, and each one can be leveraged to produce different things. In wound care, for example, here's a more detailed layer of the complexity. So what you see is a simple film, and the picture on the right is really a complex mosaic of cells and types and how they ultimately end up, being the amnion, the chorion, and the different techniques. And there's research going on all of these different products and how they could potentially use, because they contain different things. So historically, from 1927 to current day, people have been looking at these products and researching these products, and the source of continued research now, because if we can figure out which ones work best for who, for what, they can be managed and utilized where maybe there's not a lot of options from the patient themselves or any donors. So this is a little bit of a regulatory thing. It's classification of a tissue type of 361 versus a 351. One requires FDA, one's not really necessary. Here's kind of the cord itself and the lining, which is what they call Wharton's jelly. But you see the complex nature of the structure, and you can see how valuable it could be because of its job is to provide the nutrients from the mother to the baby. So, in conclusion, we're looking at regenerative medicine as a promising field. Autografting is effective. Perinatal tissue is a great sort of regenerative medicine. There's a lot of things that need to be understood in terms of modulatory influence and signal processing, etc. And so we're going to go now into a different direction. We're going to talk about the clinical application. So what we learned is there's some fundamental biology between cell signals and scaffolds, cytokines and growth factors, from the constituents of cells, where they come from bone marrow, from
Joseph Krieger, you are muted, I think please unmute yourself.
How long have I been muted?
Okay. Now it's okay.
All right. So how long was that muted for?
You can take some time, I guess, till 11, or you can say 20 minutes more.
Okay, no. So, but have you lost anything I said up to now?
No. That's okay.
Okay.
That's
So
okay.
one of the next applications we're going to look at, orthopedics is pain and spine. So in the spine world, there's a lot of opportunities. We have very unique structures like facet joints, the discs, the ligaments, and the tendons, and the ability to influence underneath the bone. And so we have autologous from you, non-autologous fiber, and you can put that in the disc. Bone marrow is used. So what you're going to see is every one of these bone, blood, fat, perinatal have an application. Different pieces and parts of them have been used and combined, like PRP and bone marrow, have been used to repair the disc. So you start to see a cross-pollination of, it's almost a form of alchemy where someone takes a pinch of this and a dash of that to create something and maybe put it back. But see, now we have organizations in 2019 like the American Academy of Pain Physicians, and they have guidelines on regenerative medicine. So how are we able to use regenerative medicine clinically for our pain patients? So structurally, we have
You are muted again. I think what happened, I don't know. Please unmute yourself, Krieger.
okay.
Okay, now it's fine. There is some problem, I think, in the me Teams. I think.
It does. Yeah, I don't think it likes me. Um,
I don't know. Maybe it happens, but I don't know.
so anyway, we were able to target using ultrasound or fluoro very specific structures of these areas and to affect change and try to reduce inflammation.
Okay, wait, Joseph, please wait. There is some problem with it. You are muted again. I don't know what happens again. Just wait for a while. I have to check what happens. You have to make presenter. Okay, you are now presenter, and now I'm allowing your mic. Okay, fine. Now you are okay now.
All right, so this is kind of how regenerative medicine can work in pain management. So again, we're going to do a bone marrow harvest here. So there's our little jamsheedy needle and the iliac crest. We're going to harvest these cells. We're going to spin them down, and then we can put them in the facet joints, the discs, the SI joint, the knee, and we have the ability to concentrate them or use them unconcentrated. And the world of research is full of trial and error. Here's kind of how they do the disc application. So we know the disc is an area of pain generators. It's very complicated. It costs a tremendous amount to society and our culture, all cultures. And we're looking at ways to heal the disc that are non-surgical. So bone marrow. So what they found is that some of these patients had as high as 70% improvement. Nobody was really made worse, so it doesn't hurt to try it. And there's all these other papers that show, so I'll have access to papers for you, but these are results and conclusions showing it works. Long-term, pain management options don't work. Spinal cord stimulation and other areas, drugs and narcotics and surgery. So the alternatives that regenerative medicine poses for patients, and obviously it depends on the patient, are very powerful. So in orthopedics, we have shoulders, knees, and hips and ankles. And you have, the use of, here's bone on bone for so knee replacement therapies are very important. We have a lot of critical structures in knees that consist of ligaments and tendons and joints, etc. We use PRP and PPP. So alpha-2 macroglobulin, interleukin receptor 1 antagonist, bone marrow, fat, Wharton's jelly, allografts. And we target specific areas with these using ultrasound or X-ray. So you can see it. You just can't shoot them in. They got to get close to where they're going. And there's been a ton of papers for OA. There's a ton of studies for OA. There's tons of outcomes for OA. There's a lot going on, and people can see the improvement over time. This is a group that did a bunch of patients, and they showed significant improvement after 3 years in functionality, in flexibility, and pain scores. 2 years later, they did a 250 patients, and they showed 62% improvement. 2-year respective shows, significant improvement, 3, 6 months, 1 year. No adverse events. Here's a multi-center analysis of adverse events of 2,300 patients showing good outcomes. There's a gentleman named Christopher Centeno who's done over 3,000 procedures for a group called Regenerative. He's a very powerful influence in the market and has developed many things and communicates prolifically on his experiences. PRP for joints, as we've said, one of the, Tommy John surgery in baseball has now been replaced primarily as a first line anyway with PRP to see if they can get that to heal without surgery. Many prominent athletes have had PRP, and they've influenced people's awareness. And the same with leukocyte rich, so modifying the white and blood cell parts. Dermatology applications are interesting because you can really see the difference where it's hard to see in a joint. Somebody may move around a little better or feel less pain, but in dermatology you can actually see it. So in wound care, hair loss, burns, and scars, you see the applications of antimicrobial and growing blood vessels and tissue support. All the different biologics are used, from A2M and IRAP to fat, primarily blood derived, not bone, but there's no reason why it couldn't be. Oh, too far ahead. So you see the ability of a fat graft, wound care. So here's the inflammatory and the remodeling phase. So here's how a wound would heal and how the stem cells function, and angiogenesis and bringing blood vessels is so important. And there's a lot of papers that talk about this. Here's someone showing that using fat in diabetic ischemic limb with a wound can show how that wound can heal. So that's actually angiographic radiology, X-ray showing blood vessel regrowth by just using processed fat along the shin. Not very technical, not very sophisticated, but again, you can't heal extremity without a blood supply. Sorry for the graphic nature of these images, but it's powerful to show how these wounds can heal. And this is where I think it's very important that people see that all these biologics, bone, blood, fat, perinatal, they can all be used to revascularize and help unhealthy tissue become healthy. And again, we have all these different wound types and how they're turning into, really positive outcomes for patients. Ideally, PRP devices are able to produce patient disease-specific products. That's the goal of the future. How do we organize these products so they develop exactly what you need? That's why there's research, that's why there's papers. And really, that's what we try to do by bringing everyone together so they can learn and use their own experiences to possibly see the difference. So again, wound care, kind of gross, but not without its effect, and very powerful if you're the patient. Fat grafting, you see people with tissue defects that are very debilitating, and you're able to remove fat from one part of the body, move it to another. Here for breast reconstruction, face, limb. Yeah, you process, you harvest the fat, you spin it, you can inject it, and again, it's point of care. Hair loss is an important area. It's not life or death unless you've had maybe some other catastrophic reason that you need your hair to come back, like a scalp injury. But looking at, regrowing, 40 million women in the United States have hair loss. Still hear me? Can you
Yeah,
hear me?
yeah.
Yeah, thank you. Thank you.
We
Just
can hear
wait.
you. We can hear you.
All right, just
Okay,
thank
okay.
you. So you see some very powerful images here of women with growing their hair back, and people think hair loss is a man's thing, but it's very powerful. And now what's happening is the technology is becoming easy enough where people can do this in their hair salon, or they can do it themselves. You microneedle the scalp, you get trichology, or the management of the health of the scalp is very important. People don't realize why their hair falls out. Well, the follicle either gets dormant or it dies. And that happens like anything else, where the skin's unhealthy, or you have a chemical buildup, or you have no circulation or poor. That's why exercise is so important in getting blood flow to different extremities, nitric oxide, gas exchange. All of the science of vascularity affects every tissue in the body. And whether your hair falls out or not, that's really a manifestation of an underlying pathology. So cosmetically, yes, but more importantly, it shows that there's underlying root cause issues that could be indicative. This is the father of one of the world's leading hair restoration specialists in Boston BioLife faculty, Alan Bauman. So he bought his son a medical degree, and his son got him a new head of hair. I guess it was a fair trade-off, but these are real pictures. It's a real person. Burns and scars are kind of close to my heart because I see people that have been affected by traumatic injury and fires, and really by getting to some of this stuff early, by really getting to burn victims quickly, you can show tremendous benefit. Here's a patient that had his face melted, if you will, by a propane tank explosion. And the manufacturer of exosomes, one of our faculty, Duncan Ross, was able to he sprayed this on his face for a week or 2 weeks, and he was able to show tremendous benefit. And if you look at the skin on the top of the right picture, it looks like an orange peel. It's actually fetal skin, because that's what the exosomes are from. They're from placenta. So it's just a powerful, when you're in the inflammatory phase, fresh injury, and you apply some of these products, you show. And if people say it doesn't work, well, tell that to this guy. Scars, simple things like this, it may not bother people. It's not life or death, but it's important. And so you're able to kind of work on the scars over time and really show a tremendous benefit. It may not matter and people don't care, but it matters to this woman. And it really sets the table for many wonderful applications. Here's a guy that he had, war veteran, a burn victim, kind of a tough guy, but he had this scar, and over time they were able to kind of diminish it and help rejuvenate it. Same with this. Again, these are modest changes, but they show that through revascularization and remodeling, we're able to provide tremendous benefit in healing structures, reducing. So reconstructive surgery, breast and facial, radical mastectomy with radiation can lead to burning, and sometimes women can't have breast implants. They can't handle some of the nuances that come with the materials, et cetera. So fat grafting is important. Here's an example of some before and afters. Again, not life or death, but certainly cosmetically and from a psychological standpoint, important. And some of the, and again, we're in the beginning of this. This isn't mainstream. These are people doing these things that are learning it on their own. There's very few places you can go to learn how to do this. So at our meetings, we try to at least identify the concepts. We work with world leaders that are doing research and clinical practice. Reaching out to these patients is so important. And everything we try to do at Boston BioLife, and hopefully you keep this in your forefront of your daily thoughts, is how to help somebody, even if it's just through a referral, saying, hey, I know a guy that knows a guy. We're happy to refer. We've got faculty around the world. These are very powerful images. And amazingly, I think, amazing cosmetic results. So in this case, they took the belly fat and turned it into functional structural enhancement for cosmetic defects. Again, severe burn victim. The elasticity in the scar tissue, when elastin gets replaced by collagen, we lose the ability for elasticity. Here's the Dr. Chernoff, who does cosmetic surgery for women, battered women, people that have had their faces destroyed through either domestic disputes or other injuries. Again, more breast images. Aesthetics is kind of a popular. Kim Kardashian really was the person that put vampire facelift on the map, and she had millions of followers, 145 million followers. And when she got her vampire facelift, which is nothing more than roughing up the surface of the skin and then applying the platelets and plasma to the skin, and this has become a cosmetic, very popular. And People pay for vanity, at least in the United States. Acne and scar. I went off.
You were there. You were there.
I was here.
You were there.
Okay. All right. So.
Neurological.
Okay. So just to follow, so all these different neurological disorders can have some use, or there's some application for regenerative medicine in these. That's important. And so one of the ways you can get regenerative medicine across the blood-brain barrier is through the cribriform plate. So people will they'll aspirate exosomes or different derivatives across this area here through the nose for neurological. Most of the time what's happening is it's anti-inflammatory. You're not really restoring any of the function. I think that's an area where we got to kind of look for future enhancement, probably more in the realm of tissue engineering. So the cribriform plate is a way to get to the blood-brain barrier. Looking at induced pluripotent stem cells, or the ability to kind of engineer things, so you can take an adult cell, you can insert genes, reprogram them, and turn them into whatever you want. So, like in Parkinson's, you may see that you may see that there's a deficit of the dopaminergic cells which come from the substantia nigra, so you can actually grow those in culture and replace them into the basal ganglia. So that could help a patient with Parkinson's restore that. So here's kind of how they do that. Again, having a reservoir, interoperative SVF, which is from fat. Again, this is the stuff they're doing in academic institutions where they're able to get stem cells through a hydrocephalus shunt into the brain, see if they can affect change by adding in the cytokines and growth factors and the signals that can influence the damaged tissue. Again, there are people doing this at UCLA, there are people doing this at Duke University, there are people doing this at Wake Forest in the United States, and I'm sure they're doing it in other parts of the world as well. So Parkinson's and Alzheimer's, obviously amyloid plaque formation, looking at how that works, and finding it prior to is the most important, because we have these beta amyloid or tau protein levels increasing in our body as we age, and we can test for them. So you're going to start seeing more testing on this, and looking at Alzheimer's. Lots of times cognitive impairment happens in the 7th to 8th decade. So there's not an awful lot people want to do about it, but if you have a demented patient, parent, loved one, very difficult on the family. Other inflammatory diseases like Crohn's and chronic fatigue syndrome. These are all inflammatory diseases that are caused by what I call the cell danger response. This is the body's reaction to epigenetic environmental influences, such as radiation, food, chemicals and processed food, preservatives, drugs, alcohol, the environment, pollution. And they create all these longer term, residual, non-ending, chronic, inflammatory based diseases. And we think things like MS, Alzheimer's, and cerebral palsy can all be longer term. And so you have the ability, patients couldn't open their hands. So they're exploring these. And a lot of times people say, well, this isn't ethical or whatever, but these patients don't have anything else. And if you talk to these patients, which I've had, they will literally try anything. And there are people out there that are willing to try it. They're willing to help, because they, and so what happens a lot of times is these patients are driven into, at least away from the United States where there's regulations on this, or they're not able to get into studies because there's just not enough studies, and there's not enough money, and there's not enough, but you can actually re-inject cells to patients that have spinal cord injuries. Dental is important. So here's kind of the lowdown on dental. So if dental can regrow bone for teeth replacement, or using it for implants, you can repair cavities, gum line, teeth can be regrown, and dental pulp has a huge source of stem cells. People are banking their stem cells from their baby teeth, or if you remove a tooth. Here's some PubMed research on dentistry, and we see this as an area of big opportunity, limited application. People aren't really doing this. They do PRP for dry socket to try to get a bone to grow. There's some bone grafting going on, but there's not a full-fledged acceptance of regenerative medicine in certain markets. And I'd say dental is one of them, but it's certainly not without its promise. certainly if you can regrow teeth, or you can stimulate the growth of or repair of tooths that are dying. And here's all the stuff you can do. And if you have, again, going back to the unfortunate patients, where you look at cleft lip and some of the cosmetic applications like Operation Smile for the kids, their face was not formed completely. So very important, and how you can repair for gingivitis. The dental market is really, ophthalmology is an interesting one because there's so many things that happen ophthalmologically, and because the retina is such a powerful organ, it's tied right to the brain, but it's highly active in that it's rejuvenating cells and neurons, and so when you have an area like that, you typically have the opportunity to interface with it structurally, but we don't have an awful lot of research to go on. So there are organizations that are working on regenerative medicine for ophthalmology, and they can look at things like retinitis pigmentosa. So here's what they call the regenerative medicine storm. University of Pittsburgh has a big area in this area where they work with the veterans and the wounded soldiers to repair their eyesight. And there's been a lot of papers, glaucoma, corneal stimulation, hydrogels being used for exosome therapies. Veterinary is a cool area, cats, dogs, and what they call companion animals, equine, orthopedics. And again, same thing. So here's these dogs, that are used in different capacities. Some are service dogs, some are athletic dogs, some are working dogs, but they suffer orthopedic injuries just like humans. And unlike humans, they can't talk, so they can only respond with yes or no. Did it work or not? So here's some you can imagine high price assets like horses. A valuable horse is $200,000. Horses, when they get injured, they don't cooperate. They're in dirty environments. So having the ability to provide wound care, here's an example of taking just the clot, take some blood, spin it down, make a clot, and graft it into the wound. Here's that happening. Oddly enough, the equine market is extremely regulated. There's almost more regulations for animals than there are for humans. And I don't know why that is, but it's certainly true. But definitely the market for animal utilization, veterinary regenerative medicine is important, and they have many, if not the same issues as humans. Tissue engineering is the future of combination of regenerative medicine, like we talked about in the beginning. Regenerative medicine is cell signals and scaffold. Tissue engineering is laboratory created tissue, and it can come, you can create blood vessels, and organoids are small versions of organs that so you can make an organoid for the brain, or the heart, or the liver, or the lungs. And if you research organoids, they're fascinating. And now you have the ability to create patient-specific disease models using small clusters of cells and test various therapies on them, and to modify them with other things like CAR-T and other immune-delivered targets, and to create situations that may be able to create like insulin-creating cells, like they do with the Isles of Langerhans. So the future, and we're winding down now, we have things like hydrogels, 3D printing, transgenic, sorry for the spelling, organs, which means we're growing our organs in other animals. And these are organoids, not organ boys. I was rushing through this slide. Surrogate donors, we're able to take other entities like animals or people and have them grow our organs in them. And not to be too futuristic, but we will be able to, in the future, either transplant an organ, print our own organ, grow our own organ, have it grown for us, make it in a lab, or have somebody repair it. So in conclusion, we're looking at all of science. So if you could read this better, we would see that nanomedicine, regenerative medicine, genetic testing, cellular imaging, antibody development, all of these technologies play a role in the future of medicine. And I believe that is the end of my presentation. Outside of the 200 interruptions, I think we did okay.
Okay, thank you very much, Mr. Krieger. I hope you all enjoyed. Now, Mr. Joseph will answer some questions. If someone have questions. Okay. Rao Zubair Khalik, I try my best to unmute you. If I have. Okay. I allow your mic. Rao Zubair Khalik, you can ask the question. You can unmute yourself. Rao Zubair Khalik, can you hear me?
Am I
Yeah.
audible, ma'am?
Yes, you are. Yes, you are. You can ask the
Okay, thank
question.
you. So, sir, my question is, first of all, my name is Raul Zubair and I'm from Bukhara. And my question is, as salamanders and lizards regenerate their amputated limb, so can we expect these regenerative medicines to perform the same function, exact same function for us, like humans?
Could you help me understand the question?
Uh,
I didn't
he
hear
want
it.
to ask about salamanders. Can we do this regenerative therapy with the salamanders? If I got the right.
No,
With
like
what?
like the salamanders and lizards have an inborn ability to regenerate their amputated limbs. So, in case of human, can we expect these regenerative medicines to perform the exact same function for us? Like in case of amputated limb in humans, can we regenerate the entire limb with the help of these
Uh,
regenerative medicines?
Well, that's a good question. And I think that that's going to be down the road, but certainly regenerative medicine is helping with things like facial transplants. So in the transplant or limb rejuvenation, much like a salamander, we're not there yet, but there are things that we have to go deeper into our genome to figure out why lower developed organisms like lizards and salamanders can regrow body parts, but humans can't. But suffice it to say that if we could figure it out, then
Okay.
really, then it is possible.
So I have another question. Can I ask?
Okay, you can. You can. Okay, sure.
Okay. Thank you. So, sir, can hematopoietic stem cells be used in order to make specific immune cells that are very, very specific and target only cancerous cells without damaging the healthy cells? Like, since this field is of, regenerative medicine is related to personalized medicine. So, can we
Yes.
make this personalized medicine even more specific by doing so?
Yeah. So, well, hemopoietic cells are really responsible for making blood. I think what you're looking for is induced pluripotent stem cells, which can become anything. So that's where they're able to take like a skin cell or a muscle cell and then culture it, but then get it to go backwards to an undifferentiated state and then coerce it to become bone, muscle, heart, brain, or whatever they need to create. So that's happening now in the lab. It's not happening in clinical practice because of regulatory, and but it is definitely possible. But that would be the pathway, not necessarily through hemopoietic cells, but from some cell from yourself. And if it were created, because it is from you, so say you made a bone or a muscle or a heart or a brain, it would in fact be compatible with the existing tissue.
Okay, I
And
think.
sir, you have also mentioned in your slides that this personalized medicine can also treat the neurological disorders. So
Yes.
I have another question, like, can we treat neurodegenerative disorders like Huntington's disease? Can we treat Huntington's disease, that is a neurological disorder also, and it is a degenerative disorder, like it degenerates the neurons. So can we treat this disorder with the help of these personalized medicines?
So I would say the answer is yes, but it depends on how far along the patient is. So the idea in personalized precision medicine is to diagnose the patient early enough so you can prevent the decay. So if somebody's already has Alzheimer's or Parkinson's, I think it's going to be difficult to restore them back to normal. But I think if someone's going to be getting those diseases based on biomarkers and other indications, you can certainly do things to help prevent it. They may not be regenerative medicine. They may be more diet.
Yeah, we have. Please unmute yourself. Please mute yourself, please. Arsalan Rasool.
Are there any more questions?
Okay, wait. I have a question. I have a question. Please wait.
Okay.
Okay, there is some disturbance. Okay, we have a question from Muhammad Mazhar Farid. He is asking, what is the role of computational biology in the domain of tissue engineering via regenerative medicine?
Say that again.
What is the role of computational biology
Oh, cool.
in the domain of tissue engineering via regenerative medicine?
Okay. Now, I'm not a big computational biology guy or a bioinformatics guy, but I'm willing to bet that if you looked at bioinformatics and computational medicine in regenerative medicine, it would be a very powerful tool, because as much as we can individualize care, we can't really make it exactly individualized without getting to that level. And so I think as we start to understand specific genes, their amino acid sequences, their nucleic acid sequences, the amino acids that make proteins, and some of the other characteristics that are responsible. So when you apply statistics, so if you looked at COVID, right, and you said, all right, who are all the people that got COVID? And then you looked at what do they have in common? So you see people with certain ages, and you see nationalities or ethnicities. You see different comorbidities like diabetics or respiratory this or that. As you start to drill down on similarities, as you develop therapies for these people, you're going to find that certain therapies will work more specifically better. So looking at the outcomes or the data that comes from large patient groups and boiling it down to something that's not necessarily reproducible, but certainly understandable, I think you have a better opportunity to formulate a specific regenerative medicine therapy for that patient or those type of patients, if that makes sense. So I think it's very powerful. It's just not there yet, but it's a great place to start.
Okay, we have another question from Saman Bibi. She is asking that what are the negative effects of stem cell therapy?
Okay, one is that they don't work. Two is that the body rejects them. Three is that they could cause, there's some things like you'll hear of tetraomas. People say, oh, stem cells cause cancer. So I think really, you know, and there are some example of that, but they've been in animal models, and they're from perinatal sources. They're not very common. So I would say really the biggest thing is, you know, whenever you have any therapy, there's surgical complications or infections, but really I think it's cost and knowledge and if it works or not. But I don't think it's going to kill you in any way. It's not, I don't think it's either works or it doesn't. And I think as we're learning more about who it works for and who it doesn't work for.
Okay. We have question from Rashid Javed. Can you unmute yourself if you are,
It
if
might
you
be
want
easy
to ask?
if you keep reading them too, it helps.
But I think there is some problem in the chat. People can't have access to chat.
Hello.
Yes. You
Hello.
can ask. Hello. You can ask the question, Rashid Javed.
Hello, Mr. Joe. Hello.
Hi.
Hello, Mr. Joseph. Thanks
Hello.
for the outstanding presentation. I want to ask that what are the possible ethical issues associated with the regenerative medicine? Like nobody want to inject the syringe in a bone marrow. So what should be the possible ethical issue associated with the regenerative medicine?
So are you talking about ethical issues?
Yes, he
Yes.
want to ask.
Well, I think that depends. It depends culturally. It depends, you know, there's religious reasons. Some people think we're killing, you know, infants or killing fetuses to do this work, and it's not true. I really think it's education. You know, as people learn, and again, that's why I try to show you the history, because people have been working on some form of this for hundreds of years. And other cultures have too. I mean, people are trying to figure out the best way to make a wound heal or, you know, a bone grow or bone heal for years, forever. you know, and so I think that ethically, you know, there's things like religious issues, cultural issues, you know, there's also access to technology because not everybody has this. So there's a steep learning curve or influence curve that I think is hard to estimate. But, you know, again, I think the ethical issues really fall along the lines of, you know, people's own beliefs. But there's certainly enough people, you know, that are interested in looking at this because, look, we have a world of drugs and surgery. People are living longer than ever before. And as we live longer, being healthy is the most important thing. So we're now, because of the length of our lifespan, we're exposing ourselves to more diseases, especially neurological diseases. So I think really ethically, it's a question of, I mean, God has given us the ability to learn these things and to use them to help our fellow man. So again, it's like anything, it's where you fall on it. I don't think we're stopping this train anytime soon. And I think you're only going to see more amazing things come out of science. And that's why we're all here.
Okay, we have another question from Myra Sumro. She is asking that what are the potential benefits of regenerative treatment as compared to the surgery?
Well, I think, you know, you can always do surgery, right? So if you look at like a knee replacement or somebody that has osteoarthritis of the knee, so somebody may have knee pain, they'll have an x-ray, the doctor says, oh, you're bone on bone. I recommend, you know, bilateral knee replacement. And, you know, the patient goes and has that done. But say they're 50 years old or 48 or 55, they have a long way to go. And those replacements wear out. So the potential benefits are to prolong or delay the need for surgery, getting people off of narcotics, helping people to be more active and to be more functional. So if you can't walk, if you have diabetes or, you know, if you're overweight or you have an injury and, you know, all these different comorbidities that affect the quality of your life, regenerative medicine in some capacity has the ability to help you with that. So the benefits, really, it's not, it can be used instead of, it can be used alongside of, and it can be used after to help enhance. You know, even if you have a surgery, by putting bone marrow or fat cells in an open surgery or a wound or a joint or a reconstruction, you can get that tissue to grow back better. So a lot of times in orthopedics, they won't do PRP or bone marrow, but they'll do it in conjunction with a bone graft, or they'll do it with a knee replacement, or they'll do it in some other surgical repair. Or if a ligament and tendon has to be fixed, a rotator cuff, they'll put those bone grafts and those stem cells right in there. So I think it's really got a lot of potential to work alongside existing modalities, but also ultimately to be something that prevents you from having to have something more dramatic and expensive.
Okay, we have a question from Noel Shamon. Is he present? He want to ask. Noel, you can unmute yourself and ask the question. Noel Shamon, are you there? You want to ask something? I think he's not there. Okay. Now we have
People can email me as well, and I'm happy to answer
you can show your email address as well.
Yeah.
If they want any question.
Yeah. So, and then I'm on Facebook.
You can share your all platform with us.
Absolutely. We can do this.
Because people still want to ask. Okay, we have Ijaz Ahmed. Ijaz Ahmed, can you ask? Do you want to ask the question? Ijaz Ahmed, you can unmute yourself. Ijaz Ahmed, can you hear me? Okay, I think. Afra Sayab. Afra Sayab, you can unmute yourself and ask the question if you want to ask. He is not present. Okay, Joseph, are you with us?
I am.
Okay, okay. There is a silent. I thought we have lost you again. Okay, I think we have. Will you share your contact details?
Yeah, it's my, if I could give it to you, just, I don't know how to share it.
Okay. Okay. Mostly people ask you to share your presentation because it looks
Yeah.
very
So I will
nice.
email that to you. I have to turn it into a PDF. Here's my email. It's Joseph Krieger at bostonbiolife.com. We have a ton of webinars that are free, that may be interesting to your listeners. And I'm happy to look at creating other content for you. I think most people found me on the WhatsApp thing too. So I'm on
So,
there, and you can all reach out to me.
okay, that's great. Okay.
All right, here I can see all the questions now. So what are the dangers of spinal injections? Well, obviously, if you don't know where you're putting the needle, you can paralyze somebody.
Okay.
But there's really there's no danger if you're an experienced pain physician and you're doing this instead of using a steroid or something. So I don't think there's. And the other question is, cell-based regenerative medicine safe? I don't think it's unsafe. I think it either works or it doesn't. And I think it's just a question of people trying things. It's not as if. Oh, I think we're going to make somebody worse. I think it can only help. And a lot of times it's worth doing because nothing else does work. So I put my phone number in there.
Okay, all of you can take his email
Sometimes
address and
it talks about, so people want how long does it work. So it depends what it is. So if you're in a phase or something like that, it may last, 6 months. It may last a longer time. Depends if it's a fat graft. If it's like a joint injection, sometimes they have to be repeated every 6 months. Interdiscal stuff, we don't know because people are still trying it. Let's see. Thanks for arranging such an informative. Oh, good. People like it. They don't work. What? Yes, they do. It's a real. I mean, I think. Look, you have to understand where we are. We have a healthcare culture, at least in the U.S., where you wait to get sick. Somebody goes and does a test. They say, "Oh my God, this is wrong with you." Then you go to the hospital. Then 10 different people look at you. So if you have a pain in your shoulder, at least in the U.S., you could have a cardiologist say you're having a heart attack, a neurosurgeon, a neurologist telling you you're having a stroke, or an orthopedic surgeon telling you you're having rotator cuff injury. So, it depends. And the patient really needs to be more responsible in understanding who they choose. It's not mainstream. There are people that are going to say, if you look at some different areas, so like the World Stem Cell Summit, a great place to look at research papers, and I'll send that. And then we have Bioinformant. There's a whole world of laboratories. Bioinformant.com is a place you can learn about all the research and stuff happening in big companies that are coming along. Perinatal Stem Cell Society, a place where you can see the research being done out of academics, which is kind of cool, like Wake Forest and Duke University and University of Utah, and I'm sure many places around the world that aren't in the U.S. are probably doing a better job than the U.S. So,
okay, it looks like we have covered almost all questions, I think.
okay, great.
Mr. Giga, is there anything else you want to cover before I wrap up?
No, but I think we should leave the door open for future communications, future meetings, if people want.
Yes, sure,
I
we will.
thank you for doing this. It's always good to review and to go through everything. And I appreciate. Sorry for all the problems, but
Yeah,
yeah,
we are also sorry for that.
we'll figure out how to do it better next time.
Okay, maybe there is a problem in Teams today because I don't know what happened today, but this is a very informative session. I really appreciate your
Good. I'm sorry.
time.
It was hard to know, who was listening, and you don't see anybody. But look, I'm an open door, and I really want to bring this stuff around the world. And one of my goals for 2020 is to get around the world. So maybe we come to Pakistan. I'm not sure. Whenever we can get out of the U.S. and the world kind of goes back to normal. However, we can collaborate. But if now, we'll just do it this way.
We hope we have a collaboration with you in the future.
Oh, you
And
absolutely.
you will come in the Pakistan. We
Yeah,
welcome you.
I would love it. I would love it.
Okay, thank you. Thank you so much, sir, for your precious time for
Yeah.
this session. And thank you, everyone.
We have a hurricane coming to Boston right now. So Hurricane Henri is coming up to New England. So we're waiting on that. So that'll be what I do next.
Okay, we will surely contact you for our future sessions with you.
Absolutely. Thank you so much. And feel free
Thank
to
you
email.
so
Well.
much. We appreciate all of you for being with us, and thank you for making the session very successful. Thank you so much, Krieger. Thank you so much. Thank you, all attendees. Hope you enjoy this session and will get you have get more information about the regenerative medicines. Thank you, all of you. This is signing off. Bye bye.